Welcome, everyone. MoreGoodDays acknowledges the traditional custodians of country throughout Australia and their connections to land, sea and community. We pay our respects to their elders past, present and emerging, and we extend that respect to all Aboriginal and Torres Strait Islander peoples today. Welcome, everyone. I'm Sonia. I'm one of the support coaches here at MoreGoodDays. I was diagnosed with fibromyalgia in 2012, and I did the MoreGoodDays program in 2022. Last year, I joined the team as a support coach and really very much enjoying it. Before we go any further, I would like to remind people that this session is recorded and that your presence here today indicates that you agree to the rules that were in the invitation. MoreGoodDays is a pain management program specifically designed for people with fibromyalgia. It is a research-backed neuroscience and psychology-based online program that helps you learn the tools and strategies to help better manage the pain and other symptoms that come with fibromyalgia. We know that management of fibromyalgia takes a multidisciplinary approach, and so we aim to cover a variety of topics. And pain science is a really, really important part of that. And that's partly what today's topic is about. We had a lot of questions submitted in advance, and we will do our best to cover as many of them as possible. Specifically, we had a lot of the questions about fatigue, and unfortunately, we just don't have enough time today to give that topic the attention it deserves, but we will be having another webinar in the future to address that and any other questions that we had to make the difficult decision to not include. If you have more questions today, please do type them in the chat. And if we're not able to address them, we'll make a note of them and include them in a future session. If you would like them to be anonymous, just change the little arrow from everyone to MoreGoodDays Sonia, and that means it'll only come to me and I'll either ask it or make note of it for the future session. Just a reminder that no expletives or hate speech of any kind will be tolerated, and keep your microphone muted. Our presenter today is Dr. Daniel Harvie, who has been a part of the MoreGoodDays team from the very beginning. And Dan is going to address some common myths about fibromyalgia and tell us more about the causes and what we can do to help manage the symptoms. I'll hand it over to Dan now and let him introduce himself.
Thank you, Sonia, and thanks everyone for coming. It's exciting to have so many people registered. I'm aware there's some 150 or so registered who will be watching this on recording follow-up. So welcome to you, whether you're here live or watching on playback. I've been a physiotherapist for 18 years, and for the last 10 of that, I've been a pain scientist as well. So that means I have a PhD, and I've been researching some of the complexities of persistent pain, something that, of course, includes fibromyalgia, but goes beyond that and affects some 1 in 5 Australians. So there's still a lot left to know about persisting pain problems. Currently, I'm an academic at the University of South Australia, so I'm continuing my research there, but I also direct our Masters of Advanced Clinical Physiotherapy program. So that involves training physiotherapists to better handle complex conditions. I'm also the author of a book called Pain and Perception, A Closer Look at Why We Hurt. I co-authored that with Lorimer Mosley. And if any of you listening have followed some pain science, you might have heard of Lorimer. He's a bit of a celebrity in the pain science world, and that's a really fun book if anyone's interested in checking it out. I'm also qualified in a sense by having experienced some of my own health challenges. I've survived cancer. I've recovered myself from persistent back pain. I have an inflammatory condition that affects my gut. So like all of you, I have a sort of personal experience degree in some of the complexities of health, and also on some of the strange interactions between our physical health and mental health and pain and other things. But of course, I don't pretend to know what it's like to have fibromyalgia from the inside either. And last but not least, I guess I've been a part of the MoreGoodDays team from the beginning, helping to construct a program that's based on current science and worthy of you excellent people. And thanks to those who've left your cameras on. It's nice to be able to see some of your beautiful faces as I talk and not to feel like I'm just talking to a computer screen. So Thanks for that. So as we talk through today, we're going to focus on some questions that have come from audience members and some common myths, starting with the unfortunate idea that fibromyalgia somehow isn't real or in your head, or some kind of untreated mental health problem, or just some label that doctors slap on when they don't know what else is wrong. And we'll move from that into talking about some other ideas and myths around treatment. So with that sort of introduction to me and this session, I might hand back to Sonia and she'll walk us through some different elements of that. Thanks, Sonia.
Yeah, thanks, Dan. I mean, let's get started on that myth that fibromyalgia isn't real. It's something that a lot of people hear and a lot of people believe, and we had a lot of questions around this topic, and I'll only read out a couple of them because there were a lot. One of them, why don't people and doctors believe our pain? And another really good one was, why do I still feel like I'm not taken seriously? The pain is debilitating. I'm sick of feeling guilty about my diagnosis, like I caused it somehow. Why?
Thanks, Sonia. These are really common experiences of people, unfortunately. And I always feel like I have to start by saying I'm genuinely sorry if you've been made to feel like your symptoms are somehow not real. I always think the last thing you need when you feel crap is also to have to feel like you have to prove that you feel like crap. It's layering on in a way that you definitely don't need. And I can only hope to answer this question in a way that helps you feel less like that and more like you are believed. But that might be lofty, a lofty aim, given that this can be incredibly frustrating for many of you. So maybe a nice place to start here is fibromyalgia actually real? And I guess there we have to define what fibromyalgia is and what we mean by, is it real? And simply, fibromyalgia is a pattern of symptoms that includes things like widespread pain and often many other symptoms as well. And so then the question is, like, how do we know if these symptoms are real? And, you know, the first and I think strongest evidence that it is real is that something like 2% of the adult population reports this pattern of symptoms. And if we just took the USA, that's something like 4 million people who independently report this pattern of symptoms. And it can't be that 4 million people have colluded to somehow make up this pattern of symptoms that we refer to as fibromyalgia. But unfortunately, there are still a few dinosaur thinkers, some of them doctors, who are just not up to date with the science of fibromyalgia and pain more broadly. And perhaps rather than admit they don't have all the answers, prefer to dismiss symptoms, which can naturally make people feel accused as though they're somehow putting it on. But you're certainly not. And a second point to make here is that pain is something that you experience internally, as are symptoms of fatigue and other things. They're very internal, and there's no test. There's no test for what you experience. And so from the outside, you can look okay, but at the same time, on the inside, you can feel anything but okay. And again, this can lead to dinosaur thinkers dismissing your very genuine symptoms. And if you come up against that, then I can encourage you to find a more up-to-date healthcare team in order to find that more supportive environment and a community of people who understand fibromyalgia and recognize that it is a real pattern of symptoms. Maybe the final thing to say on this point is that, or to emphasize, is that if you experience pain, your pain is real. The only question then for me is, what is the cause? But even if you can't identify a specific cause on a blood test or an X-ray, that doesn't mean that the symptom is not real. It's an understandable frustration. We like to be able to measure things, to prove things, but we just, at this point in history, we don't have a test. We don't have a medical test for all of the potential causes. of people's ongoing pain problems. But that doesn't mean it's not real, and it clearly is. So I might leave that one there, Sonia, and hand back to you for the next bit.
Lovely. And it is nice to have someone with a degree really saying, yes, it's real. I know that can be relieving to have that validation there. So what actually is fibromyalgia? What's the pathophysiology? And we had a couple of questions sort of related to that. And is it hereditary or related to the MTHFR gene? Is it the same as central sensitization or chronic widespread pain, or are they other diagnoses?
Great question. I already alluded to fibromyalgia as being a pattern of symptoms that involves things like widespread pain, fatigue, sleep problems, foggy brain, sometimes referred to as fibro fog. And there are still quite a lot of theories about the causes and contributors. My understanding of where the science currently sits can be summarized in three main areas. The first and best established part of the physiology is a change in the way the nervous system processes information from the body. This is consistent across the literature, and you could think of this or summarize this as a shift of the nervous system towards a state of overprotection. So the nervous system is always trying to make sense of information. It's filtering out certain signals. It's suppressing some, it's amplifying others. And on balance, it seems like the nervous system shifts towards this state of overprotection where signals from the body tend to be amplified. So that's one part. The second part is there seems to be some evidence of low levels of what we call systemic inflammation. Inflammation is produced by your immune system, and more of it tends to sensitize the nerves in your body, making them more likely to send signals into your nervous system that is then already primed to amplify those further. So that's another potential layer of the problem. And then there's some evidence around some other things, like some potential changes in the small nerve fibers of the body. So I guess a message from there is there's multiple elements. It's a little complicated, but the most accepted, the part of that puzzle, if you like, that has the most evidence are these changes in the nervous system. Jumping to some of the other sub-questions there, does it relate to the MTHFR gene? There is some evidence that people with fibromyalgia are a bit more likely to have that gene variant, but there are plenty of people with fibromyalgia who don't have it. And there are plenty of people like myself who have one of those gene variants but don't have fibromyalgia. So there may be a contributing factor in that particular gene. There may be contributing factors in other gene variants, but I would never place all the blame on one particular domain. I think this sort of genetic background that we all have is probably part of the puzzle of what predisposes some people to developing fibromyalgia and some not. There was another question about central sensitization and whether fibromyalgia is the same as central sensitization. Central sensitization is just a simple term that we use to describe the way signals from the body can be amplified in the nervous system. So it's not that fibromyalgia is the same as central sensitization, but central sensitization is one term that we could use to refer to the state of the nervous system being more in this state of overprotection with this greater tendency to amplify signals from the body, if that makes sense. Have I missed anything from that? There was a few sub-questions there. Sonia, can you flag any
there's
that
been
I've
an extra question in the chat. Could you just
addressed?
talk a little bit about what the that gene is again? Just actually what the gene actually is.
Yeah, so the MTHFR gene relates to the breaking down of folate and the production of B vitamins, which are involved in energy release in the body. I think this is why there's been a bit of buzz around it, because some people have some hope that that might help explain some of the fatigue symptoms. And so some people try supplementing a type of B vitamins that has already gone through this process of breaking down into units that are more absorbed and more able to be used by the body. So I think they're called methylated B vitamins or something. So some people try those. You know, I think to a degree it can be healthy to try some of these things, but I always caution people about the merry-go-round of trying different supplements and going down these rabbit warrens of different theories. Sometimes they can lead people to useful adjunct therapies. At other times, they can be very expensive and, in a way, distract people from the science-backed strategies that we know are helpful. So, yeah, that's hopefully covers that.
Thanks for that. So what actually causes fibromyalgia? Is there a catalyst? And there's a few questions related to that. Can fibro happen to people who have experienced trauma throughout their lives? And if that's the case, does working on that trauma incident help?
Yeah, another great question. I like to frame this rather than as what would cause fibromyalgia, but instead frame the question as what would drive the body, the nervous system, and the immune system towards a more overprotective state, a state that is more likely to amplify signals from the body, to be more pro-inflammatory, to have more protective muscle spasm. What would cause all of these systems to go in the same direction of being more overprotective? And I think certainly different types of trauma can trigger those bodily systems into these more protective states. But that trauma can come in many different shapes and sizes. So it could be an illness like a virus that perturbs these systems towards this more protective state. It could be a physical trauma like a car accident, or it could be an emotional trauma, or some composition of all of these. And it could be one really significant event, or it could be lots of them across a long period of time. Undoubtedly, there's a background of a hereditary predisposition, perhaps related to genetics. And that's sort of obvious because not everyone who goes through these traumatic events ends up with fibromyalgia. So there does seem to be some predisposition that some of us have towards developing these types of problems. A way to view this situation as well, because also some people have these traumatic events that perturb these systems into this more protective state, but then the normal response is that the state of those systems comes back to baseline over time. But a way to view the situation is that the stressor or the multiple stresses, which might be virus, physical, mental, over time they perturb these systems into this overprotective state, but then these systems fail to return to baseline over time, and then they adopt a sort of new normal at this elevated state of protection. And I'd love everyone to read a blog that we have on the MoreGoodDays website about that idea and a concept called allostasis. Perhaps we can email that out to the group. But this understanding of fibromyalgia is why we've given so much thought to how we can then normalize the function of those systems and bring, say, the nervous system back down to a less protective state with less amplification of signals, how we can wind down the muscular system to have less spasm, how we can normalize some other protective systems like the stress systems and the autonomic nervous system. Yeah, so I hope that gives you a sense of what I think actually our best understanding is of fibromyalgia and some of the underlying physiology at this point in history.
Thanks, Dan. I guess, and that sort of leads into the next question, and it was part of the myth that you alluded to at the very start. Is it just untreated depression or anxiety or trauma and that sort of thing? And some questions that were related to that was, why does my fibromyalgia get worse when I get stressed? When it does that, it does kind of feel like it is all in my head. And is the pain that we are experiencing related to our bodies telling us that our lifestyle or our circumstances are just not okay, or perhaps that we are normalizing an unhealthy relationship, or that something really big needs to change?
Another great question. I think this idea that fibromyalgia is somehow an untreated mental health problem it's just a bit of a misunderstanding of the fibromyalgia research. And it's what I would call a reductionist argument, where a complex problem is reduced to a simple throwaway argument. A better way to think about this is that mental health challenges and other stresses, as I mentioned, physical, health-related stresses, they can predispose fibromyalgia because of the way they can perturb our systems. And not only can they predispose it, but they can also help to maintain it. But that's only one factor amongst a number of potential contributing factors. And it's very different to say that, say, depression or anxiety can contribute to fibromyalgia. That's very different to saying that fibromyalgia is untreated depression or anxiety. I hope you can sort of see and roll with the nuance of that, because, you know, I would hate people to hear that and in a way get defensive, because I think it's best that we do remain open to embracing this connection between mind and body, and accept that at least in part, these interactions between our mental health and our nervous system, our mental health and our immune system can be part of the puzzle of understanding how fibromyalgia is developed, how it's maintained, and also how can we reverse engineer that, which maybe is the most important thing for us, in order to try to calm some of these systems that are maintaining systems. So why is fibromyalgia worse with stress? You know, some people notice this connections. Some people don't notice it so strongly. It can be a little bit like, you know, dietary triggers for a gut problem. You know, you can eat something today, but gut symptoms might not present for 2 weeks. And so then sort of making the connection then between the dietary trigger and the gut problem is very difficult. So I've just want to throw that in here as well, because some of you might not have noticed connections between stress and your symptoms. It doesn't mean that they're not necessarily there. It's just that the effects can be delayed and sort of difficult to notice. But there's a few ways that stress can interact with systems. One is it can be part of winding up the nervous system into this more protective state. But it can also have this connection with cortisol, so stress hormones, and stress hormones can interact with inflammation in the body. And, you know, stress, you know, you might have heard the phrase fight or flight as a mode of the body. And the opposite to that is rest, digest, and repair. So if we're always in a stress mode, then it might be more difficult for our body to calm in this rest, digest, and repair mode. So that can also be part of how our body systems become out of sync and then remain out of balance. There was at least one other part to your question, Sonia. Can you remind?
Yeah, that was Is the pain kind of telling us that our lifestyle circumstances are not okay, and does something big need to change?
Yeah, so that's tricky. I'd say that's a big question, and probably, as many questions are, better answered on an individual basis. But what I would say is that if you keep doing the same thing, you will tend to get the same result. And so almost always the way forward is to change something, to change a circumstance in order to trigger some change within you and your bodily systems. And this can be part of the problem of adopting treatment strategies that purely focus on things like medication and rest, because those things don't necessarily force you to make changes in your life that can also stimulate changes in some of those systems that might have become in this more overprotective state. So I think, look, it's fair to view pain and symptoms as a sign that something needs to change, but the what, I guess, is the part of the question that's best answered on an individual basis. And you can certainly, with understanding the types of things that you can change and how, sometimes you're best placed to identify in what ways you need to change with things regarding your mental health or your physical activity, whatever it is. But having the knowledge around those things is the first step.
Thanks,
Back
Sam.
to you, Sonia.
That actually segues really quite nicely into the second half of this webinar. And that's, so we've got two opposing myths that surround the management of fibromyalgia. And those tend to be that you should avoid doing anything at all that triggers a pain response. Or on the other side of that you should just push through all of the symptoms, ignore them, and just keep on living your life as normal. So what really is the best way to manage fibromyalgia, and what are the latest findings in that regard?
Yeah, so there tends to be different ways of responding to pain, sort of patterns of behavior, if you like, that can tend to maintain the cycle, and always avoiding triggers, which can involve doing less, resting more. That can be very unhelpful and can lead to you becoming less physically fit. It can lead to you being less engaged in work and social activities, and in that way can be part of a cycle of maintaining symptoms. On the other end of the spectrum, if you take a purely no pain, no gain approach and you keep pushing through and you keep flaring up in serious ways, then those flare-ups can also maintain a cycle of sensitivity. So just with regards to activity, there's this happy medium where you find a sort of Goldilocks zone of activity where you accept that some pain is okay and you keep trying to gradually do more, but at the same time trying to avoid those flare-ups that will tend to maintain a cycle of sensitivity as well. And it's a very delicate dance, and finding that right level of activity can be really challenging, and understanding the principles of pacing and graded activity in a really detailed way can really help you get the balance right with activity across your days and weeks. I think sometimes we underestimate how helpful those simple interventions can be, and we go into those in good detail in the program. So that's the sort of first part. Then what are the best ways then to manage fibromyalgia? I think as we currently understand it, I think step one is to understand fibromyalgia and pain at quite a deep level. Your doctor's only with you for 10 minutes a week at most. So with any ongoing condition, you sort of need to be in the driver's seat. You need to to understand enough to drive your management yourself. It's not easy and it needs to be personalized to you, but likely the best management for you will involve some combination of things that help you manage your symptoms. So these might be things like medications, pacing strategies. So I call those management strategies. But then you also want to have a good plan around things that go beyond just managing day-to-day symptoms, and have a good plan around things that help move you forwards and balance your nervous system, improve the resilience of your body. And so that means layering on top of those management interventions, the medications, the pacing, massage, whatever it is that helps you manage the day-to-day symptoms. And if you view your body as a garden, I'm not sure. I think we have this analogy in the program somewhere, but I really love it. If you want to have a good garden that's bearing fruit, that's got beautiful flowers, you have to look a year or 2 years ahead, and you've got to water it and weed it and make sure it gets enough sunlight and fertilizer, and laying that sort of groundwork and tending to the garden day to day doesn't necessarily produce you a beautiful garden in 1, 2, and 3 weeks. It's looking ahead to a year and 2 years' time. And so this means getting to know psychological strategies that help calm your nervous system. It means understanding how flare-ups work, how to minimize them. It can mean identifying strategies on increasing your levels of movement and encouraging your body to build resilience. It may mean some specific things for you on an individual basis. It might mean identifying and addressing past traumas. It could mean identifying aspects of your diet that are inflammatory. It could mean psychological interventions like mindfulness, pain reprocessing therapy, cognitive behavioral therapy. It's like the message here is it's likely to be a package of things that help to calm the nervous system and build the resilience of your body. And it's likely to mean applying them over a sustained period of time with a long-term view. Rather than the cycle of the quick fixes, because you're really trying to retrain some of those systems, and it does take time. But as I said earlier, if you don't do something different, nothing changes as well. And I think that the analogy of a garden is kind of nice, because there's all these strategies, some of that I mentioned there, that are a little bit like tending to your body as a garden on a daily basis, and trying to gradually coach those systems towards a lower state of protection, a greater state of resilience, ultimately leading to better managed symptoms and less pain. So that's where I see it is now. I think there might be some questions later where some specific medications and things are mentioned.
Yes.
I'll leave that for now.
Yeah, no, I do love that garden analogy. We do need the sunlight and the water and all of the things that a garden needs as well. And so a question related to the treatment is there any other kind of relief for pain besides opioids and marijuana and over-the-counter medications? And related to that, is it true that once a patient goes on to pain medication, that they'll need higher and higher doses over time as the body becomes accustomed to that medication?
Great question. I'll answer this question with a little bit of caution, being not a pharmacist, but been around persistent pain for a long time and have a bit of a handle on where the evidence is for pharmaceutical management of persistent pain problems. So, talk to a specialist, talk to your pharmacist. But yes, there are other classes of medications that some people find really helpful. Not everyone, and so it's a case of you might need to try them. see how they go. If they're not helping, don't stay on them, because there's no point enduring this potential side effects if you're not benefiting. But some of those drugs are in the classes of antidepressants, so they're prescribed at lower doses for pain, not for depression per se, although some people might benefit there as well. So that's drugs like amitriptyline. Some people benefit from a class of drugs that are known as anti-seizure medications. You know, the theme here is these are medications that target the nervous system in some way and change the balance of neurotransmitters in the nervous system. In a way, these are helpful for some people is more evidence that things in the nervous system are the things that are the most important factors underpinning the problem. So those you'll need to talk to your doctor about. Beyond the opioids, I think sometimes we can be very quick to dismiss the simple analgesics as well, the Panadols and the Nurofen. I think some people don't find them very effective, partly because of how they use them. And an example of using them in an ineffective way would be waiting until your pain is really bad and then expecting these simple analgesics to help, because very often at that point they may not. Whereas if you'd preempted a flare-up and took them before the pain was bad, often people find they're a lot more effective. There's some other ways of taking them. So, for example, Panadol or paracetamol comes in a slow release form. And there seems to be something about the slow release, and it's something like having this background low level of analgesia across time that people find more effective than taking it and sort of having the dosage spike and then taper off again. So some people find that more effective as well. I'd just flag that even though we call these simple analgesics and you can get them over the counter, they're not without potential side effects. So, always have a chat to your pharmacist. I don't know if you guys have realized, but in Australia, pharmacists these days can be really good resources. And if you find a good one, having a chat to a pharmacist can be like a consultation with your doctor. So if you're going into a pharmacy, grabbing something and walking out all the time, you're probably not getting the benefit that you could from your pharmacist. But like any health professional, there's also pharmacists and pharmacists. So, but have a go at using your pharmacist for advice around how you can best or optimize your use of the simple analgesics, and particularly talk to them if you are on other medications, have other health problems, or are concerned about potential side effects, because they're training for that sort of advice is better than your average GP. So yeah, make sure you use them. The other really important question was whether you need higher doses over time. And that really depends on the type of medication. So that is certainly true for the opioid class of medications, endone, codeine, fentanyl. There's a whole group of medications. If you're not sure whether what you're using comes under that class of an opioid, ask your doctor. They do tend, that they're the strongest pain relief in the short term, but they are the main class of medication which you're likely to need more of over time, particularly if you use it on any kind of regular basis. And the effect of that essentially is it feels good in the short term, but you become more sensitive over time. And the science of that is because you're putting those opioids into your body externally, your body essentially thinks it no longer needs to produce those natural pain relievers as much itself. And your immune system gets better at taking those opioids out of your system, leaving you at a higher level of sensitivity. But that principle does not seem to be true for a lot of other medications like those simple analgesics, the Panadols and the Nurophens. And I think that is really important to know, because I think some people don't use Panadol and Nurofen effective enough because they're worried that they'll become medication. You should, monitor for potential side effects and talk to your pharmacist. But that's one fear you don't need to worry about unless you're on something like an opioid. And if you are, I'd encourage you to chat to your doctor about weaning off of that and trying to introduce something else to replace it. So it's one thing I worry about is, some persistent pain sufferers just one day rock up at their doctor and their doctor just takes the opioids away without replacing it with other things or other strategies. And, sometimes that's okay, but I worry that does leave some people without enough tools to manage their symptoms. So I guess be aware of that. Try and wean off opioids if you're on them, because then they're not good long term. But I don't want any of you to be in high levels of debilitating pain. So try and make sure you've got some other strategies. And the things you learn through the MoreGoodDays program, for example, some people find those as useful ways of managing pain. But it's nice if you can find some things that can give you short-term relief as well. Back to you, Sonia.
Yeah, thanks. I know that was certainly true for me. I found the MoreGoodDays program really helpful. So the last group of questions, while we're sort of on the topic of opposing myths, is there a cure? Do people ever fully recover? And on the other side of that, is it progressive or degenerative, and does it get worse with age?
Yeah, good questions to clarify, particularly on the second part, because I think it's natural for people to worry that it's going to get worse with age, And if we look at persistent pain across the lifespan, the prevalence of pain problems goes up a little bit around the 40s and 50s, but actually plateaus from there. And, we see, from 50 to 80, we see changes in the body, like more disc bulges and degenerative changes and things on X-ray, but we actually don't see more pain as a percentage of the population, which is really interesting. And I think a myth in the general population that would be nice if we could do away with. Getting older doesn't necessarily have to mean more pain. Is there a cure to fibromyalgia? In the strict sense, no. I think it's the popular opinion and the one backed by evidence. But there are many people who would describe themselves as recovered, in the sense that they live normal lives, they have good control of their symptoms, they manage to avoid most or all flare-ups. And it's also interesting to realize there are actually some psychological strategies where part of the core of those strategies is accepting that symptoms won't go away. And something interesting happens in accepting that things might not change. And it's that there's some part of you that lets go of some struggle that is in itself stressful and can be part of winding up a sensitive nervous system. This continuous search for answers and explanations, and this frustration with not finding cures. There's something in the practice of acceptance and being mindful that ironically helps symptoms. In the acceptance of symptoms can reduce drastically. So there's just sort of like an interesting characteristic of symptoms that sometimes, I don't know if any of you have ever gone to the doctor because something hurts or you feel ill, and then you're sitting in the waiting room and you're like, oh, I'm not feeling it anymore. The purpose of symptoms is to trigger us to do something. And if we arrive at the doctor, or we arrive at More Good Days, or we find peace in acceptance of how things are now, then in some sense, the purpose of those symptoms has been served. And in the letting go of some of the struggle of that, sometimes symptoms can also reduce. I went a little bit around in circles there, but hopefully that gives a sense of that. It's not degenerative. Fibromyalgia is not a degenerative condition. And on average, it doesn't get worse with time. So even in studies that have not treated people, they've just looked at them across time. And I'm thinking of one in particular that followed 170 people with fibromyalgia across 18 months. What they observed, and they didn't do any treatment, but what they observed was 2/3 of people stayed about the same and 1/3 of people got better. Of course, what we would hope is if in those studies they'd intervened, or they had everyone do the More Good Days program or something, hopefully we would have also seen a substantial group of those, or a much larger group of those that got better. But even without anything, the expectation is that, if symptoms fluctuate, as I'm not telling any of you anything, symptoms fluctuate across years and across weeks and days, but on average, they don't get worse across time. It's not a degenerative condition in that way. Before I hand back to Sonia for the last time, thanks a lot for having me. I hope to come back on one of these in the future. I want to acknowledge that we've covered quite a bit of ground fairly quickly, from what fibromyalgia is to what causes it, and some of the things that can help. These ideas can be confusing if you're hearing them for the first time, and that's really why we're here and why we've created More Good Days, so that you don't have to wrestle with those ideas and challenges on your own. And what we've tried to do is, rather than leave it to people to chase all of these different treatments and try to understand all of the science from psychology and physiotherapy and neuroscience, we've tried to do the work of bringing those things together in a package that's accessible, so that you can become the expert in your own health journey and take control to better manage symptoms and to reduce them over time. So I think Sonia's going to talk to you a little bit more about what's included in the More Good Days program. But thanks a lot for having me, and I hope to see you all again.
Yes, thank you very much, Dan. That was super informative and really, really helpful. We'll definitely have you back in the future. There have been a lot of questions, and I'm sure there'll be more. The program that Dan talked about just then is what we call our long-term pain rewiring program, and it's an 8-week journey, and it includes sort of all of the educational things that Dan has mentioned throughout this session, and dedicated support coach, and you get 3 psychology sessions with one of our pain psychologists to go deeper into what you're learning. And you also get weekly live sessions similar to this one on a variety of topics, including movement, mindset, lifestyle, and a few other things. We do open them up every now and then to the public, but subscribers get them every single week. And together, or that combination of coach, psychology, and sessions and education, that helps you to better manage your pain, your fatigue, and the other symptoms that do come with fibro. And we help you learn to retrain your pain response system over time. We do have excellent clinical outcomes. We've got partnership with Dan and the University of South Australia to make sure that we're constantly learning and improving and adding content and bringing the up-to-date knowledge to all of you in an accessible kind of way. And as I sort of mentioned at the start, for the people who missed my introduction, I do have fibromyalgia, and I did the More Good Days program, and I went from barely surviving to really thriving. And like Dan said, I'm not cured. I don't class myself as not having fibromyalgia anymore, but I certainly do live a really fulfilling and active lifestyle, and that really really helps. And today we do have a special offer for anyone who registered for this webinar. It's 20% off our long-term pain rewiring program. It is only available for the next 7 days. So if you're watching the replay and it's after the 17th of April, I'm sorry, that will have expired. But if you're interested in signing up, we will send all those details in the email. We'll also include that link that Dan mentioned earlier so that you can read that blog. And if you've got any questions that you want answered about our program, we've got about 3 minutes left, so you could ask them now. Otherwise, there'll be a link in the email for you to book a time, and a support coach can give you a call directly and answer your questions. And there's no obligation to that phone call. We're happy to have a chat to you about our program at any stage. So if there is any questions, either a last minute question for Dan, if we've got one that can be answered in 2 minutes, or a question about the program, then please feel free to ask them.
Hi, this is Rudy. Can you hear me?
Yes.
Yeah, I just want to comment there on an excellent presentation, and I got a lot out of it. I've been living with FM for 2 decades. But this program, this session went a long way to rewiring my central nervous system. Thank you.
Thank you, Rudy. That was lovely.
Yeah, thanks, Rudy. That's lovely to hear.
All right. Well, we'll finish up. So thank you again to Dan, and thank you to everybody who made the time and anyone who's watching online. It is an extra effort to spend an hour using your brain when you've got fibromyalgia. So thank you for making the time and effort, and we really appreciate that everybody did join us. Thank you.
All the best, everyone. Take care.